The damage in a cellular basis is completely different from under 45 and over 45. But when we're not changing the table for a new table, we're just changing maybe just one of the legs. The more your cellular level could respond to the treatment than the one that's very, very older. So we have to separate systemic issues to very focalized issues. Big amount of cells that were under that amount of stress that they aged 10, 20 years in just like that, a moment.
We're not in the office.
No.
We're spending so many hours
every
in the clinic.
Once in a while, you guys, we deserve a special, I don't know, dinner or something to just go a breather.
See, the friends who came with us from Chicago, they're enjoying the environment.
Yeah, they're
so
always
much
beaming.
That after treatments, they're completely gone.
Only except the doctor, right? No, this time I put my foot down and I said, I want to beam too.
So we said, okay, glass of wine in this beautiful scenario.
And I said, no, glass of wine. Well, okay. Right?
I have to torture you a little bit more.
Nah, don't you worry.
I have friends who are texting me
Okay.
a lot of questions still regarding the treatments, why and if they're gonna come and what kind of treatments.
Let's see if we can,
let's see if we can answer.
Clarify a little bit.
A few people.
Don't worry. Shoot.
So, the Magda G is asking, what are the kind of treatments that your team offers? Because I know you're generally in Querétaro, which is like middle part of Mexico. One day you're always seeing your patients in Mexico City, and sometimes the lucky patients are coming to Cancun, like this group.
It's a land for the lucky. No. It's a beautiful land. Well, it depends a little bit. We have a lot of different particular treatments. There's a lot of stuff going on, but we can more or less broad scope go there by, let's say, per parts.
Okay.
So one part of the treatment is really orientated to keeping you healthy, keeping you happy, keeping you beaming with beauty, wellness. So that'll be anti-aging medicine. How can you get the best of what you have and keep it, more or less? Then I have patients that actually have something and they're starting to see signs and symptoms of wearing out. So they usually have some degenerative issue, like there usually goes into regenerative medicine. Could be stem cells, things are sort of that area.
So just to repair something.
Exactly. And then we have patients that are more, concerned about certain specific kind of pain, like neurological pain or maybe joint pain or something, very focal. Right. So that'll be the general areas, and depending which.
Usually we hear my knee hurts,
of course.
My elbow, my back.
Yeah, your shoulder, yeah.
Lower back. Oh my goodness, 80% of popularity, they suffer lower back pain.
And then it's very seasonal, it gets winter, it's joint stuff, bone issues, everybody, rheumatism, everybody's aching. Right. Then it hits summer, golf elbow, tennis elbow, I got the sports guy. The joggers, the knee, so it's seasonal,
That's why youngsters are coming and they visit you.
They have their own issues, by the way. Acne, everybody, carries something.
My son was one of them, a gymnast.
I'm not saying names.
A lot of, damage, unfortunately, that's the truth.
So it depends, Magda G. The time of year, the type of patient, the age, the gender, genetics. So we'll hopefully try to make it as personalized as possible.
I have Lucas who is asking, how can I know if I'm eligible to receive the stem treatment, and is it recommended? How does he know? Okay, perfect. It's a big answer. We try to summarize it as much as possible. Squeeze it.
So Lucas, first of all, we need to know, how old are you? Because it's not the same age time cellular wise.
Okay.
Under 15, over 15, over 35.
So the age matters.
Of course, the wearing out process, the damage in a cellular basis, it's completely different from under 45 and over 45. Then the gender. Males don't usually overwork certain areas as women do. As for example, neuroendocrine system. Females use much more hormones than guys do. Okay. So it depends.
How quickly you lose the percentage of stem cells that you carry in your body? Because you're born with them. Those are designed to repair,
of course,
and keep your body going, all the organs I imagine inside. So what's the difference between 20, 40, 70?
Let's try to make it, very easy. Like one question you can ask yourself is, how does my family usually age? Let's try to go more specific. How long do they usually live? 60-ish, 70-ish, 80-ish, 90-ish, over 100? So if you're aging over 100, you're gonna have stem cells, working a lot longer than the guy that is usually done for at 60. Right. So the amount of damage stored in those 60 years is gonna be comparable to the 1 to 100 years old.
Okay. That's the difference.
Yeah, that's the main difference. So more time here, more chances to get toxins, pollution, bad habits, stress, and whatever we're still, popping in.
Because I understand having it in my body computer, if they stop working or they get older, it's even more effect and more benefits that I'm gonna receive by the injection because I'm getting them new.
Well, yes, but that's just one part of the equation. The second part is it still something we can stimulate to try and regenerate? Okay. But we're not changing the table for a new table. We're just changing maybe just one of the legs, or just this part of the table. So, but you still need some part of functionality in that table to talk about regeneration.
I understand those smart cells are going and adapting in our body and repairing. We don't even know what was supposed to be done, right?
Of course.
Sometimes. I think dolphins, they made a little interruption. But I have Tomek.
Okay.
He's saying, how much time, doctor, do you need for me to receive stem cells treatment?
What I gather
How
from...
long is it gonna take, I understand, to receive the treatment?
Well, depending. For example, we had cases where we have neurological cases. They're very difficult. Sometimes we have to apply maybe 2 different treatments in the course of maybe 15 days.
Okay.
So the treatment per se really doesn't take that long. It's like an hour-long process. We have the interview, we check all the specific information, the lab works. We explain the pros, the cons, the expectations. We run through the whole case and try to do it as personalized as possible.
Okay.
Then, on a second visit, we do the application. It's something around an hour. And let's say anti-aging wise, so let's say the standard treatment, that's how long it would usually take. Okay. Special cases like knees, elbow joints or back, and you have to go very specific. Try to get the stem cells as close as possible. In those cases, well, it takes a little longer, like an hour and a half, maybe 2 hours.
So the basic injection that you guys are getting, I'm speaking for myself because I got 3 already, every single year 1. This is not a long process. It's more important how am I gonna behave and what am I gonna do with my body after that. But a lot of our friends, they're having knees, they having like a locally, right?
Of course.
You injecting.
They put the whole list, of issues, and you're like, oh my God.
Basically, I want it here. I want it here. No, doctor, I want it here.
So we have to separate systemic issues to very focalized issues.
Okay.
If it's very, very focal, we need to be more close to the place where there's the damage. And if it's more systemic, we can use a systemic pathway.
And that's how you customize those stem cells.
Of course.
Depending on particular case of the patient,
exactly.
Right? Like my dad, he had a problem with heart. Serious cardiac problems. Some changes,
heart failure along with arrhythmia and hypertension.
For example, you're lucky that every cell has to go through the whole circulation, so eventually it's going to get to the heart, right?
Yeah.
So that's a very good plus. But
you enhance it. I know you put something extra that he felt so good.
Well, he also complemented like chelation therapy, supplementation, nutrition, exercising. And we boosted, with other medication to try and get as much oxygen as possible to the cells, so we can boost, the reproduction phase. And he's such a good trooper. He follows instruction, such discipline. There's really no wonder from my side he was gonna do that good.
This is all magical process to me, because he is, first of all, he's out of medicine.
The dancing and thinking about the senoritas, that got me out of the blue. I wasn't expecting that, but yeah, the feeling good, yes.
But that was a part of happiness, done by stem cells or not, but it was. I have Joanna, the last two questions.
Perfect.
Joanna is asking, what is the normal post-treatment recommendation? What should they do? Because everybody is like, can I go swim? Can I go to the gym? What should I eat? Like, how you can make those stem cells comfortable in our body.
Exactly.
And make them the most powerful, because we're coming here all the way. We're paying for the treatment. We're going the hard way.
How can you get the most out of your treatment?
Benefits.
So first of all, we have to understand, when are the cells getting the extra regeneration level?
Okay.
Deep sleep. So I need you to tone down a little bit.
That's a problem for many people.
A little bit. I know you're in Mexico, you want to go dancing, you're in Cancun, seeing the dolphins, etc., but tone down. What else inflames the system? Food. What is the food that inflames the most?
Is there any
high carb
kind of
diets
food that they shouldn't
super
eat?
High carbs. We try to tone it down a little bit. And high on red meats.
Okay.
They inflammate too much the system. So we try to tone it down a little bit.
Cheese?
You can take it, but not overdo it. You're not taking 1 kilo of cheese, right? Or half a pound.
And
coffee?
Cytrynówka?
Well, you can take maybe a glass. Because if
a glass of cytrynówka?
Or like tequila shot. Excuse me.
We have to introduce.
We have to be very specific. I forgot we're going to the Polish public. Yeah,
we're going with the high percentage.
And they're very literal, by the way.
So very moderate on alcohol too, because this is gonna weaken the
idea is not to dehydrate the cells.
Okay.
So alcohol usually exchanges to intercellular water. So the idea is, you're not going to function fine with cytrynówka inside, right? In a cellular level.
But I think for a few days, for people who really care and want to see the results,
yeah, of course,
they can even give it up. For a few days, you can do it.
You can go better with a little bit more fermented issues. Like, for example, 1 beer or 2, you could take. It's better for the cell than, like hard liquor, for example.
We drink sauerkraut juice.
It could work. It could work. If you have to take 1 or 2 glasses of wine, you could have it. But other than that, no, because you're going to become dehydrated. Yeah. So we want to boost the function, not tone it down.
I would increase the.
Then what else we're going to do? We're going to give you extra antioxidants, so you don't get that inflammation you're already having from stress, from traveling, from leaving home, work, pandemic, blah, blah, blah. So we have to tone down the oxidation levels. How we're going to do that? So we're going to get different supplementation to help you tone down the levels of free radicals and oxidation. If you really can't do it by yourself, or you're off the charts, freaking out of those issues are so constant in everyday life, we can use ozone therapy directly. So what we're doing, since ozone is a gas, we're not applying the gas inside the body, since that will be harmful and dangerous. What we're doing is getting your blood, as you can see right now in the syringe, mixing it up with ozone, medical grade, medical concentration, getting ozonified that blood, and then we will be returning the same blood to your body, so there's nothing weird or strange in you. Exactly. for a systemic like shutdown of the whole oxidation levels.
Or sometimes
We want to take care of your cells.
Like a little package to work together
That'll
with
be the best.
ozone therapy.
The people that usually, have their mindset to do, look, doc, I came all this way and I'm not leaving till I feel fine. That attitude is going to get you even further than the one that says, look, I'm here, I'm going to party.
Are they putting too much stress on the doctor?
Yeah, of course. You're stressing me with so much limitation. I'm just taking the stem cells and I'm going to have red meat.
Right. I heard from my girlfriend that she was about to come to Mexico. She's planning to, and she's like, Ilona, I want to be Jennifer Lopez. So we have
many people will be writing their wish list.
I want to do it. And the last person is asking, is there any age limit recommended or a best age for the treatment?
Okay.
Because families with kids or adults like my parents, it depends on the age or?
Depends on the damage. We're talking about cells. So cells, their age is different from the one we usually chronologically,
can count.
Yeah. Mm-hmm. An age in a cellular level is how many replication it has. How can you more or less know? More stress, cells die, they divide, and to try to replenish what's been, damaged. So each time a new cell has to come in and, pick up where the last one left off, that's aging in a cellular level. So for example, a newborn with, umbilical cord wrapped around the neck with high hypoxia, mild brain damage, blah, 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 had such big amount of cells that were under that amount of stress that they aged 10, 20 years in just like that, a moment.
So you're telling me that 40, 50 years old is going to look and feel like a baby?
Have you seen people like 90, but they have beautiful skin, no little bags under the eyes as the doctor, and big smiley faces.
And that's not happening from Tylenol.
I would change their 90 for my 40s, right?
And those people are persistent, because like you said before, it comes as a package.
But I have patients, there are newborns, for example, those issues. And I have patients that are 98, 99, even 101, I have patients. You have to know, the younger you are, the more your cellular level could respond to the treatment than the one that's very, very older.
I think by talking about it, we're increasing our level of expectations. We're putting more resolutions.
Well, if you're putting Jennifer Lopez on the table, I was like, oh man, I have to.
So when we come back, we can do the wish or
Doc,
the dream come true.
Give me the Lopez cocktail. They're gonna go like that. I said, ooh.
Mojito? The Stem Cells Mojito is waiting in Mexico. If you guys have any more questions, you can always torture our duck and ask more and more, because with this process, I know you've been doing this for years, and for you is the standard, and you do it to yourself too and your family.
Well, that's the only way I can really vouch that this stuff really works. Right. If it didn't, I wouldn't spend any of your time.
I think the best proof is from people who are returning. It's like in every single business, returning patients.
Of course.
This is the proof that they not only trust you, but they trust the treatment that you're giving them.
And I don't know if they've written you, but I have been written, they're messaging like, Doc, why Cancun? Well, I have patients that, it's really difficult for them to separate from family. Right. And sometimes the only excuse to come and get their treatment is, let's go on a vacation. It's easier to get a direct flight from Chicago, for example, directly to Cancun. You guys have fun, have a blast in the all-inclusive where it's safe, where it's fun, where it's cool, where it's amazing, and I can go treat myself. Right. So it's kind of like a family issue, a time issue, and trying to make a win-win for everybody. So that's the why.
So with the nature of vitamin D, wonderful food, the whole environment that we expect in Mexico, this is a win-win situation.
Of course.
Nothing else to add.
See you in Cancun then, or Mexico, Querétaro.
Other locations.
Guys, if you have other questions, please write.